Afternoon. Welcome to our very last session of the Healthcare and Life Sciences track at TC18. So show of hands, how many of you enjoyed the Adam Grant presentation this morning? I'm reading out loud, so it was particularly relevant for me. If you remember Adam's presentation, the keynote, Adam Salipsky's presentation Monday, which may seem like eons ago, Adam actually referenced the opioid monitoring and surveillance work, which our next set of presenters are going to talk about. I'm Andy Day. I'm the Senior Director for Healthcare and Life Sciences at Tableau. I helped found the Healthcare and Life Sciences business unit, as well as this Healthcare and Life Sciences track. So it is personally gratifying to see the audience grow about 25 to 30% every year. We had, just as this was the largest TC, we also had the largest Healthcare and Life Sciences audience at TC this year, which is extremely gratifying. So our next presentation comes from north of the border, from Alberta Health Services, which is the largest integrated healthcare system in Canada and also our largest customer in Canada. So we are very, very privileged to have Dr. Hussein Osman, who's the Executive Director of Public Health and Infrastructure, and Jesse Tutt, who's the Program Lead for their IT Analytics Center of Excellence, delivered this pretty unique twofold story about how Alberta Health Services uses visual analytics to manage its IT infrastructure on one side and operations, as well as opioid monitoring and surveillance, which obviously is a huge problem in this country, and Canada comes right after. So it's a big problem, both sides of the border, so hopefully very relevant across the entire continent. So with that brief introduction, Dr. Usman and Jesse, please take it away. Thank you so much. Big round of applause for them.
There we go. Can you hear me now? Yep. All right, great. All right. First of all, I'd like to thank you all for coming. Was anyone able to attend the data night out last night? Exceptional. Exceptional. Yeah, it was neat to play Pac-Man again. It brought me back. And I guess more specifically, I want to thank those that are actually joining us from north of the border. Any hands? Anybody from Canada? All right. And anybody from south of the border? Yeah, a few hands. That's good. And I guess the rest would come from the middle, or from east or west. So thank you all for coming. So our presentation is going to, like Andy mentioned, go through a little bit of the IT reporting from a performance perspective. We have some program reporting, and then delve into the opioid crisis. I'll start it off and go through the IT program reporting. So Alberta Health Services, for those that don't know, is an organization. We are, in fact, about the 5th biggest company in Canada. We have 4.2 different Albertans that we support. We have about 100,000 employees, and then an additional 50,000 people that use our systems. From a IT perspective, we have about 5,000 servers, 90,000 computers, and about 150,000, like I mentioned, user IDs that we support. So, just to set the scale. For those that don't know, we are located right above Montana. So there's in Canada, there's BC, then Alberta, and Alberta is right. It's landlocked and right above Montana. My presentation will be on the art of IT performance measurement. From a team perspective, just a little bit of background, we started the team a year ago. We have a very small team. There's me and 2 other guys. And we have 2 summer students, and that's it. So everything I'm going to present was accomplished literally in about a year, from start to scratch. And in an organization of our size, with our complexity, I just want to share that because it doesn't actually take a big team, and I would actually suggest the contrary. Start with a small team. IT actually has approximately 2,000 employees. We spend about $500 million a year. And we also are implementing Epic, which is a clinical information system for those that do IT that is used by kind of the creme de la creme of healthcare systems. It's great. And that program is a really big transformational program. So from a business process change, it will impact every single person that works for us. and the cost is approximately $1.5 billion. So we're talking some pretty serious investment, which requires proper reporting, which we're going to get to here soon. My team's three primary focuses is reducing costs, improving service delivery, and naturally increasing risk transparency. From an overview perspective, we don't have time to go through this in detail, but I wanted to share this. You're going to have access to it through the deck. We have inputs. We grab data from 100 different data sources today, including organizational structure, building, risk, technology stack, the applications that we use, both from a desktop software perspective, Citrix, and enterprise application perspective. The permissions that everyone has, we also have data sources for that. The staffing, I should add the people that aren't staff, which is a big number. We have like 50,000 people that don't directly report to the organization that is AHS. We have relationships with probably, and I don't actually note this, but probably 50 to 60 different companies that use our services that aren't us, and 10,000 physicians. So from a security and permissioning perspective, there are challenges with that. From operations management, we do operational reporting, we're going to get to, financial reporting, and we also add the capability or enterprise architecture views as well. We use business logic, so we report all of these things by role, by organization, by building, and by budget. We use applications, including Tableau. And we have SSIS, which we use for ETL processes. And next up, we use some scripts to interact with systems that don't have APIs and don't have databases, such as the technology stack, including storage arrays and whatnot. And lastly, we are working on a robotic process automation, which helps us to not just see the data, use machine learning to understand the data, but act on the data in the same way that a person does, using mouse clicks and keystrokes. Robotic process automation, for those that don't know, is not programming. It is not interacting with a software system, using the database or using APIs. All it does is mimic keystrokes. So if you have people that do stuff, you can train a bot to do some of that stuff naturally. So that's another area that we're working on, which we'll speak to. We correlate the data. We do quality assurance to make sure that if there's any data gaps, we work with the service owner or the application owner to fix that data in the source system. We work on presentation to a variety of different audiences to ultimately lead to decision-making and informed decision-making. We have a whole list of strategic questions there. What's the growth of our resources? How many things do we support? I'm not going to go through them all, and you can see them. But the strategic questions, I highly suggest ironing out. That's really a great place to start with when you're creating a brand new IT analytics team, or any analytics team, really. You'll notice that almost all these questions relate, if you take out the word IT, you could do this for finance or a medical unit. So a lot of these concepts do transfer. The decision-making will ultimately lead to action, which ultimately drives outcomes. From a maturity perspective, in the context of our IT department, which we do operate a hub-and-spoke model in AHS, we have probably 3,000 Tableau developers, or sorry, 300, not 3,000. Sorry, got ahead of myself. Not yet. So we started basically with a business intelligence capability, kind of being able to report on individual source systems. Over the last year, we've kind of progressed to the advanced analytics, being able to do prescriptive and predictive reporting for a lot of the different areas that we do reporting for. Next game is really to bring that out to the data science level, and so we are working to allow us to move into the more mature analytical maturity, which we'll see here soon. From a value perspective, I share this slide because I think it's really important when you're communicating the value of what you do that creating a report with the end in mind. Any of us can do that. We can go talk to the system owners and potentially look at the dashboard that's already exists in the application. That's not really the value of what we do. Our value is really correlating data across systems and bringing in new insight. And so often that takes place, and the greatest value is found by connecting these systems with an open mind. Looking at connecting this and this and saying maybe I didn't expect anything, but finding something. And so for the most part, our system our findings and the value that we've been offering isn't known questions. It's actually looking at data and just finding things. What systems are in this system, or sorry, what people are in this system that aren't in this one? You know, maybe there's people that have left the organization that still have access. Maybe there's people that have access to this that shouldn't, or are in this role, and it doesn't really make sense. So there's maybe there's a person that is with the organization that has used this system or has access to it but hasn't used it, meaning that we can potentially turn off those that access or that system those systems or that infrastructure and save money. Underutilized resource reporting has been a big find. The very first step when we created the team was to look at the Gartner metrics framework. Now, this framework is actually created by a company called CEB that recently got purchased by Gartner. If you have a Gartner account, you can get the full document. It's probably 80 pages of KPIs with strategic questions that can be used to bring to your leadership and say, hey, which one of these is important? Which is what I did. I took this list on the screen to our CIO, and she checked off, Penny checked off a whole bunch of the ones that she felt were important, and that's what really drove a lot of our reporting. If you see these themes of financial performance and risk and project performance and operational performance and talent management, which is your employee satisfaction, and lastly, customer satisfaction, those themes are actually found in all of our dashboards. Our data warehouse, which we've been working on, contains all the people that we support, including both staff and non-staff, physicians, non-physicians. So we have a lot of metadata on all of our people, from the HR system for the people that work for us, and Active Directory, and a variety of others. That people data we connect to the systems that they use: desktop software, Citrix published applications, and enterprise applications. We then connect that data to the technology stack, if a person has a computer or a phone or all these other things, to the permissions, to the demand that they place on IT, to the organizational structure so that we can report up and down the org structure based on where you sit in the org. If you want to see everything that is connected to your staff, we have the ability to do that. And lastly, from a building perspective, we have 700 buildings across the province that have network that we support in them. I think the number is closer to 1,200 if you look at the number of buildings that our people operate in. So being able to report by building is extremely crucial as we plan and start to move into this EPIC implementation. From a communication perspective, we want to be able to communicate at the building level, ideally down to the unit level, which is another initiative we're working on. Lastly, risk underlies it all. And so risk reporting is definitely an important area that we're starting to work on. We've had some success, and I look forward to developing. A few of the challenges that we face. So we have a bit of data, about 15 petabytes, which is nothing compared to a lot of the other players and attendees of this this conference, but it is a challenge. Number two is the number of stakeholders. We have 2,000 people in IT, and then we have a whole thousands of other stakeholders that are above, customers of IT, really. From a system perspective, we have about 1,600 enterprise applications. We have Cerner, we have Meditech, we have Millennium, and we're working to merge at least 400 of those enterprise applications into the EPIC implementation, which is really exciting. I certainly look in the next few years to see that number decrease quickly. Master data, having the ability to actually link people to buildings requires us to have the same building name in the systems, or at least being able to connect them. And for a lot of our different building names, we've seen examples where there's 20 different names for the same building. So correlating that data and actually working on master data is really key. Next up is getting access to the data. I don't know how many people have actually had challenges extracting data from a database live that's in the cloud. How many people have extracted data from a system that's in the cloud? Yeah, so there's a few, but it's a challenge. And lastly is resistance. Anybody seen any resistance from different? Yeah. How many people have asked for access to data and not been able to define why they needed access to that data? Data science. I need it because I'm hoping to connect it to other data to see if I can find something. It's not easy. People are usually not open to that. And so with the support of our CIO, we've been working through and gotten access, blanket access, in fact, to all systems to understand who's using them and who has access to them. One thing that I hadn't even considered when we were working through that with all the different groups. And had I not had that, I would probably be here for another 20 years working on that, 1,600 systems and, meeting upon meeting. So yeah, really appreciative of our leadership of supporting those kind of ideas. From a dashboarding perspective, one quick tip that we found is creating a dashboard of dashboards. It seems intuitive, but I would highly suggest simply having a link that people can save, one single URL, adding all your dashboards to it. Instead of sending in a URL to each of the sub-dashboards, refer to the master dashboard. Secondly, from a financial performance perspective, look and see if there's data that actually you can benchmark to. HIMSS maybe, or CHIMS, or of course Gartner, which is another organization that does allow and provide benchmarking data. You can see in this case, the organization has been getting a bit more money on a year-by-year basis, and our percentage has actually decreased in the past year or two. Next up, from a KPI perspective, we already reviewed a few of those sample strategic questions that we really have focused our reporting on and our KPIs. So from a structure perspective, all of our dashboards from a leadership perspective include the KPI at the very top. Next up, we talk about the trigger, which I see is cut off, but it is the trigger. And by trigger, we mean what's causing that KPI to go up or down. Next up is the trend. So, okay, our KPI is currently not where we want it to be, but we're headed in the right direction. And I know a lot of people support the Rouge report or only showing things that are red. But I think enabling a dashboard to show the success is also important. So you can see some of these measures, KPIs, do show a positive trend. Next up is READMEs. Kind of a simple thing, but when you're in that discussion with the business leaders and potentially a service owner or budget owner or a leader or a director will come up to you and say, hey, I don't know if I buy that. What are your assumptions? Where's your data sources? Our dashboards note that. You can just check out the README and you'll see where the data came from, what limitations that are there, the bias potentially. Anyway, there's an easy way of contacting us, a quick hyperlink to an email. We've got usage, how do you use this? Definitions, and lastly, purpose. Connecting the data. Like I mentioned in the beginning, getting data and creating a report that already exists isn't really, super valuable. The value is connecting and correlating the data across systems, which this is just one dashboard, but you can see we've got the strategic Gartner time model, which is tolerate, invest, eliminate, and migrate. A simple classification of where are these applications going in the future. The eliminate quadrant of our 1,600 enterprise apps, you can see there's a lot of dots there, and clearly articulating that we are planning and hope to eliminate these applications. It's a great input to prioritizing your spend and your resources, and hopefully driving transformation. Next up, we have our demand. So on an application by application basis, you can see exactly how many tickets are we getting on that thing. Is it increasing? Is it decreasing? Potentially, hey, why is there that big bump, which appears to be kind of in the January timeframe? And what's the trend? Obviously, we're seeing an increase in tickets, both on the incidents and request perspective. Next up is the number of people using each system, which is the size of the dot. We have our TCO calculations, the color of the dot, and then of course TCO is the size. Next up is the database infrastructure and server infrastructure that supports that the application. And of course, how many hours are being spent supporting that application. So pulling that all together, it certainly adds value. Next up is a really recent initiative that we're working on and feverishly. So from a change perspective, we have been working to connect and understand what data is in our organization. I think every organization is pushing through to drive that. Layered on that is machine learning, which allows us to look at the unstructured data and understand more meaning from it. Now, I think having reporting, especially in most of the BI tools, doesn't delve into that, and there's extreme value because every system and every data source and almost every table these days has unstructured data that we need to extract meaning from. And so we're working on that using Python to understand precisely what is the meaning of the IT unstructured data, whether it's service desk or tickets or surveys, or maybe financial notes, or maybe it's documents. Machine learning has a ton of value, and I highly suggest checking it out. So we've got the data, we're working to extract the meaning, and then the last piece is that robotic process automation to accomplish action. One way that we're working on right now, actively, is to look at our service IT requests, whether it's an incident or a service request. So an incident is something that's broken, a service request is something that you want. So we're looking at the requests, trying to understand through machine learning and natural language processing what exactly is requested in that software ticket. Then drive a recommendation or a recommended action, and ultimately complete that action. And I guess just to add to that, just to put it into context, 6 weeks ago, my team of 2 people and 2 summer students started playing around with machine learning. We checked out quite a few of the different vendors, and there are many. And we're currently using Python, but we could have just as easily done it using IBM Watson or Google Cognitive Services or Microsoft or the Amazon solutions. They all have the capability. In our case, we chose Python only because we could do it on-prem, and we didn't have to upload our data to the cloud. We're healthcare, as many of you are. We've got some challenges with regard to that. So we took 250 tickets. We classified them using a machine learning algorithm, and we were able to figure out 95% of the time what the category was. Was it hardware, software, or access? Pretty simple and fairly successful, not bad. 6 weeks after, a week ago, we ended up training a model on 25,000 software tickets, and we're able to accurately predict 99.98% of the time exactly what kind of software was requested for requests that only needed one piece of software, which it's the majority. So you can show that, or that shows really to me that any of you, we had literally 0 machine learning experience, can literally start an initiative and move into that kind of success within a very short timeline with 20 lines of code. That's it. It's 20 lines. And these are freely open source tools that can integrate with Tableau and can integrate with SQL, which is in our case what we work, SQL Server 2017. So yeah, highly suggest checking them out. So from an impact perspective, in the past year, we've created a brand new team. We have created a data warehouse. We've ingested data from, in fact, over 100 different systems. We've completed 100 presentations, and I note that because for all of you, to get support for analytics, you need to get in front of the leadership, and then the director level, and then the manager level, and then the staff level. And so, make sure that you don't forget any of those layers because they're all actually very crucial to the success of your reporting. And that takes meeting with people. And so I don't do anything of value other than meeting with our customers and trying to educate them on what we're working on and gather their business requirements. And so, I think that's absolutely crucial. Next up, we've created 50 different dashboards, which have been viewed 10,000 times by 600 people out of around 2,000. So we're looking at about a third of adoption right now within IT. Naturally, the inclination or the roles are usually more senior in nature, but we have a lot of heavy hitters that are actually at the staffing level, which is great. We've identified a lot of underutilized resources that could potentially be reclaimed to save money, a lot of money, which is great. And lastly, we've developed reporting on our performance, which has really supported a lot of process improvement, which has resulted in a 15% reduction in open requests, 82% reduction in open hardware and software requests, and 34% reduction in open incidents, simply by showing people, you have these things open, these are old, these haven't been actioned for a long time, and hey, putting it in the hands of our customers. From a lessons learned perspective, find the pain. Find out what one dashboard that is really causing a pain for your leadership. Don't start with a dashboard. Don't talk about KPIs. Start small. Keep something that you have data for, and ask if there's an area that needs some improvement. If there is, create a dashboard of it, and then through an agile format. We use Scrum, and I highly suggest checking it out. It's 30 pages. I mean, you all have time to check that out and probably become certified if you're interested in that. But create a list of different things and start to prioritize your work on a monthly basis is certainly that small, keep it small kind of culture. Next up, PROSI is change management training that allows you to work through, identify places of gaps in terms of your organizational change management. We're not talking about IT management or change management. It's really process and organizational. And so, find an executive sponsor that's really, and I guess we're jumping here, but create a small team, which we spoke to. Next up is find a visible sponsor. So in our case, our CIO is very supportive and has really expressed an interest. Our IT executive are on board, and so having that sponsorship at the very top is crucial. Next up is creating a placement. Make sure that the vision that you're working from has the strategic questions, like the ones that we talked about, which were checked off, and then the full picture of what you're doing in a very simple way that you can communicate it to staff. Now, granted, that model isn't necessarily super simple, but it is a way of communicating what you're doing, how you're doing it, and your audience. And driving out the outcome, which is ultimately quite crucial. Once you create the placemat, share it like we talked about. Get it out in front of the people. Get input. Make sure that you're obviously updating it as required. Next up is prioritize your work using Scrum, like we mentioned. Create a dashboard of dashboards. And then measure who's actually using the dashboard. Tableau's got great functionality to understand precisely who's looking at it. And if it's being looked at, that's great. Talk to the people that use it the most and ask how you can improve it. If it's not being used, get rid of it. No sense in having it. And so I was talking to a peer here a few days ago, and they have a script that automatically extracts the workbook and dumps it. So yeah, kind of interesting to make sure that your views are in fact clean in your workbooks. And that's about it. So I'm going to pass it on to Hussein. Hey, Hussein. Yeah. Thank you. Yeah. What's that? Hey, thank you. Yeah.
Thank you so much, Jesse. So I'm going to be talking about the opioid crisis and how we are responding to that using analytics in Alberta. So I'm going to start with a few acknowledgements, acknowledging my department. So like Canada Geese, we are strong. We show a lot of endurance, we are highly skillful, and we work as a team. The work on the opioid that I'm going to be sharing with you, there are a few names that I want to share with you, the work that they have done. I'm the head of the department, so I want to make sure that they get the acknowledgement. A few names that I want to take are Adrian, Jordan, Vivian, and Jaman. And there is one more name at the Alberta Health Services level, which is a big organization, and his name is Jason Scarlett. He's our team lead for the Tableau team. And being an epidemiologist, I say to Jason that, Jason, you are the case zero of this Tableau epidemic in Alberta. So if you look at this graph, there have been 72,000 drug overdose deaths in US in last year. Out of these, almost 48,000 were because of the opioid overdose. Sometimes there's different types of opioids involved in a death. Now, if we compare this with a few other statistics, like in 2016, there were around 40,000 deaths due to road traffic collisions. When the HIV epidemic was at its peak, the highest number of deaths that we saw in a year in US was at 40,000. So this helps us understand that this is a #1 public health crisis that we are dealing with at this moment. Now I'm moving on to a few numbers from Alberta. As you can see, in the year 2017, we saw a total of 583 deaths, and that is only because of the fentanyl overdose. And for the opioids, the number of deaths were around 700. And that is, again, 2 times the number of deaths we saw in 2017 for the road traffic collisions. So I'm just trying to give you some comparative numbers so that you can understand that this is a huge public health problem. So how are we responding to this epidemic of opioid use in Alberta? So we do surveillance. We have programs to help the Albertans. And also we do program monitoring. And for all these 3 areas, we are using Tableau and other analytic tools for a very efficient response in Alberta. And it is definitely very challenging because we are dealing with a lot of data sources, which adds complexity to managing the data and analyzing it, and also disseminating. So I'm going to talk a little bit about each of these challenges. The data sources only for the opioid surveillance that we are using are deaths data from the medical examiner, emergency department visits for opioid overdose, and same hospitalizations for the same condition, physician visits, emergency medical services data, and then we have a system in Alberta called HealthLink where you can call and talk to a nurse for assistance. And also we have take-home naloxone program, and I'm going to talk more about that. We also have some program monitoring data for that program. For those who don't know, take-home naloxone is a life-saving drug. When opioid overdose happens, it actually slowly and gradually stops your breathing. And if you inject naloxone, it reverses the condition and patient is able to breathe. And it is life-saving, no doubt about it. When you're dealing with a lot of data sources, in the traditional world of surveillance, I've been in this area for the last 20 years, and I remember those days where we would create the tables in Excel and charts and put them together into a paper-based report, create a PDF, and send it to our users. That requires a lot of resources, a lot of time. And then we say in public health, particularly in the world of surveillance, that if you have created a fabulous report, but if the users are not able to have access to the report, that is usually of not much use. So dissemination is extremely important. And as Jesse was saying, Alberta Health Services is a big organization. We have over 100,000 employees, and then we also have partners that we work with in the communities. So disseminating information to them is extremely important. And imagine doing a daily report and sending it to 100,000 people and whoever is using that. I think that is not possible. And the timeliness at which we share the information is also important for the action part. At the end of the day, surveillance information is produced for action. All right, so like many of you people, I also listen to a lot of TED Talks, and I came across this fact. Zara, the fashion design house, they can design and distribute a garment to market in just 4 to 6 weeks, as compared to other fashion houses taking 9 months. And their business model has been extremely successful because they can get very quick feedback, what is selling, what is not selling. They get feedback from their customers, they can make changes, send out new designs. And they have been able to actually achieve this by these different factors that I'm showing you on the slide. They have streamlined their entire production process. We have done something very similar using Tableau. So Tableau has been a game changer for us. I joined the organization about 6 years ago. Everything was on paper, everything. And at that time, I was coming from the Centers for Disease Control in Atlanta after doing my fellowship in public health informatics. And we had the tools, we had great people, we had the data sources. All we had to do was to come up with a new model and change the way we were doing things. So we developed this in-house analytics infrastructure using Tableau and some other tools. This at a very high level shows you our model that we have. We use a lot of SAS for data management, data analysis, the things that we cannot do in Tableau. So we get connected with the data source, ideally on the server, and pull the data in the SAS environment. But as Jesse was saying, IT people are not always kind with us and give access to all the systems. So sometimes they say, we'll give you a file of data when you need it. So we also bring that all in the SAS environment. And we write the SAS code. A lot of coding is written in SAS. And then we push out summary tables based on the type of visualizations we want to create in Tableau. And then from there, you publish the dashboard, you give access to your viewers, and then we put our SAS code on a schedule. So every night, depending upon how we would like to refresh our dashboard, some are near real time, some are daily updates, weekly updates, and so on. So it runs and it refreshes the data, and the dashboard is updated. One important thing I want to mention here is that the way Tableau is evolving over the years, we are saying that the role that we have for SAS in this process is going to be less and less because of improved data processing, data preparation within the Tableau environment. So as Tableau it keeps getting better, we are eliminating the role of SAS in that process. But there are some advanced modeling of statistics that we have to do in SAS and push that information out in SAS, or in Tableau. All right, so now I'm going to show you a few examples of our dashboards. So this is a snapshot of our Alberta Opioid surveillance dashboard. I know that it is a crowded slide, but just what I want to share with you is that each dashboard that we create has a summary tab. On the summary tab, it provides key indicators that people are interested in seeing upfront. And then if you see, it has multiple tabs. So for example, I was sharing with you that we have emergency department, medical examiners, EMS, and lots of data sources that we tap into for the dashboard. So you provide major indicators on the main page. And then if somebody is interested in more information about the emergency department visits, there's a separate tab for that. You go in there, and then at that tab, you can actually go and look at information at a very granular level. Some people are interested in their own emergency department. They can go there and see how my emergency department is doing and all that. So I'm going to show you a few zoomed in snapshots. So for example, this one is showing us the number of emergency department visits by the ICD-10 coding that we have selected for last around 15 years. But the neat thing about this is that there are drop-downs over here that you can look at the data in many different ways. So you can look at the information for your own particular zone. You can look at it by age, by sex. You can look at it by month, by week, and all that. So that provides a tremendous flexibility for our users, and they really love that. Now imagine doing this based on your paper-based reports. This dashboard could have been like a 400 pages report with all those possibilities of data combination that you can see in there. Now what I'm highlighting over here is showing you the intensity of that problem, that every month these days we are seeing around 500 emergency department visits due to opioid overdose for a population of 4.2 million. So you can understand how big it is. Another thing that I want to share with you is that this is a visual to help you understand the potency of heroin, fentanyl, and carfentanyl. So this is the lethal dose that we are showing. So you can see from here that fentanyl is about 100 times more potent than heroin, and carfentanyl is another 100 times more potent than fentanyl. Carfentanyl is usually used to sedate elephants. Now, we are seeing carfentanyl in the community as well, and I'm going to show you how we do surveillance on that and how it triggers action. So when an overdose happens, there is an EMS response, the emergency medical services. They go to the patient and they see an opioid overdose, and then they administer naloxone or Narcan. And the high potency overdose requires high dose of naloxone to reverse the patient, to restore the breathing. So if it is a fentanyl overdose, it might require, let's say, somewhere around like 0.8, 0.9 milligrams of naloxone. But if it is an overdose with carfentanyl, which is very highly potent, they might have to give over 2 milligrams of naloxone, because they keep giving the dose until the patient reverses. Now, for a person in surveillance, that is a highly valuable, actionable surveillance information for us, because this is a very early indication for us that there is perhaps a new batch of pills in the community with carfentanyl in there, and people should know about it. So we have this EMS data stream where we map the information by the EMS responses and by the dose they are providing. So in the next snapshot, these are, for example, the postal codes where EMS responded and they had to provide more than 2 milligrams of naloxone. And what we are doing with that information now is that we are developing an inbuilt automated trigger using the new feature that we have in Tableau that came in last year to send out alerts to our medical officers that here is an area where in last 2 days we are seeing 4 or 5 EMS responses that required higher dose of naloxone, which means that there is carfentanyl most likely in the community. And then they work with the community organizations for messaging and public health response. So this example is very important because surveillance is all about informed decision making. And that is highly valuable information for our medical officers and our partners. Now this dashboard that I'm sharing with you is publicly available, and as Andy was mentioning that the CEO mentioned this in his keynote. So we have this program where people can go at different walk-in clinics and pharmacies and take home naloxone from there free of cost. And very early in our response, we thought that we should facilitate Albertans in getting hold of this life-saving medicine. So we created this publicly available dashboard, deployed that on the public server, where you can go and find out where is the nearest pharmacy or a walk-in clinic that I can go and take the take-home naloxone. So you can search it in many different ways. So for example, Airdrie is a small city close to Calgary. So if you use this drop-down and click your city, and when you hover over these dots, it will give you the street address, it will give you the phone number. We advise them to call the center first before they go and pick up the take-home naloxone. And this dashboard, we did a refresh and all, so I'm forgetting the number, but it has been accessed many, many thousand times in Alberta. Then we also have dashboards for the monitoring of the take-home naloxone program. So as you can see over here, we have so far distributed over 80,000 take-home naloxone kits in Alberta. This is a closer look at that bar chart. And similarly, some breakdown. So this type of data really helps our program folks to keep an eye on how the program is doing, and it helps with quality improvement and see what changes we want to make in the program. So I was having a chat with a few colleagues during the conference, and I came to know that some organizations are thinking about creating opioid surveillance dashboards for their jurisdictions. I want to share with you that because of the Tableau infrastructure that we have, we were able to deploy all these dashboards around, I think, more than 2 years ago. And we were very efficient. As soon as we had heightened response in Alberta, my department knew what their job was. And because of the infrastructure that we had and highly trained people, we were able to actually deploy that dashboard and then many others very quickly. So in public health, particularly in the world of surveillance, it is very important to respond in a timely manner. Otherwise, a lot of important decisions are going to be made without good data. Now, similarly, as you would know, that cannabis has been legalized in Canada on 17th of October. My team was able to deploy the cannabis surveillance dashboard on 16th of October, a day before the legalization. And then, for example, there are sometimes natural disasters like floods, fires in BC, sending smoke to Alberta. So we are able to very quickly deploy our dashboards because of the infrastructure that we have. And then similarly, if there's an outbreak for that type of a situation, we have the capability to deploy a dashboard within 1 or 2 days. So I'm going to summarize a few important benefits that we are seeing that I have touched upon a little bit before as well. So if we compare our efficiency to what we had about 5 years ago, and this is definitely my qualitative assessment, so please don't hold me accountable for that. So I strongly believe that we are 10 times more, and in terms of like the products that we have, but not only that we have more surveillance products, they are more comprehensive. So when I look back, I don't think we can now create what we're creating in Tableau on paper anymore, because it's still, I mean, it's not possible. It's a lot of information. You cannot do that on paper. So not only that we are producing more, we have around 30 to 40 comprehensive dashboards on almost each surveillance topic, both on communicable diseases and non-communicable diseases, as well as on emerging issues like cannabis, opioid, fires, air quality, and all those. The other important point is the short turnaround time and full version control. So when I was working for the Division of HIV and AIDS Prevention in Atlanta 7, 8 years ago, our division was trying to create an HIV atlas. And that was a map that would show you the prevalence and incidence of HIV in US by states. And I can tell you that definitely we did not have Tableau there at that time. So we had an IT vendor hired for that. I think it took them about 2 to 3 years to develop that. The amount I cannot share with you, how much it cost us, with no version control. And we understand that anything that we create is never perfect the first time. Even if it is perfect for that time, it has to improve like the iPhone. Every time you have to come up with a better version. By this in-house infrastructure that we have full version control. When we get feedback from our medical officers and other users, we are able to make changes in our products, in our dashboards very quickly. Because at the end of the day, it is all about how the users are using the information, how would they like to see information. Cost, absolutely. We are avoiding a lot of cost. We have not done any study on this, but you can imagine if we created these 30 to 40 dashboards, hiring some contractors without Tableau, it would have been a lot of cost. Access I've talked about. Once we create a dashboard, depending upon the sensitivity of the data, we are able to provide access to all AHS employees versus the selected ones. For example, if it's your opioid dashboard, because it is sensitive data, or if it is a sexually transmitted infection dashboard, then you provide access to a limited number of people. But then we have respiratory virus surveillance dashboard like influenza and other viruses. That is open to all AHS, and we also have a publicly available version of that dashboard deployed on the Tableau public. And obviously, it is providing a very high quality user experience that leads to improved support and program planning. Thank you so much.
Isn't that an awesome presentation, right? That is relevant across both sides of the border. We have time for a few questions. I'll ask my colleague to take some questions there. So we'll flip between this side and that side to ensure, equal representation.
Hello, thank you very much for your presentation. I love both topics. I work for Prime Therapeutics, Pharmacy Benefit Manager. Real quick, on the IT analytics front, what kind of business support do you have or interaction? And are you within IT or under the business? Because what we're struggling with is how to get business logic within and communicate that to IT. So I'd be interested just in an overview of how business is related to your IT analytics initiative.
Sure. Yeah, it's great. And so within our IT space, I do sit within IT. We have a center of expertise run by Glenn, and I report to Glenn. From a structure perspective, in terms of support, we engage all of the different service owners within IT who all support the systems that the business uses. And so from a data perspective, we can work with them to understand the business logic in the databases. You're thinking kind of data model. Is that what your question pertains to? Yeah. So we get vendor support. We tie in vendors where we need to. But for the most part, from a data modeling perspective, for most systems, we can actually figure out the data model in an hour or two. We've had some really complicated ones that we really need to delve in and talk to the vendors. But for the most part, we actually don't even engage. We can get access to a system and understand the meaning of it in fairly quick order. 20 or 30 tables, 50 or to 100 might take a bit more time. And then we have support from the database team. We have an external finance team that we've been working at on the financial tables. And so, yeah, it's kind of a vague answer, but we work with the business where we need to and where they have that expertise. And we try and figure things out on our own where we can. And if not, then we reach out. Yeah. Thank you. Good question. Yeah.
Hey, what's your data sources for their surveillance maps? I work for a payer. Most of our members are in New York City. Would love to have that kind of real-time surveillance of overdoses and things like that, but claims lag, things like that, it can be hard to get real-time data. What were your data sources for that dashboard?
Right. So your question is about the data sources for the mapping? And, okay. So we are able to actually map almost all data sources that we have. What I was showing you was the EMS data, the EMS responses. But Alberta, we have access to the provincial data. So when a person is identified in the emergency department with an overdose, we have access to the postal code of the residence of the person, and we are able to map that as well. So in terms of the timeliness, I think the other part of the question, we have near real-time access to the emergency department visits, HealthLink calls. EMS is a little delayed, but with the new system that they are moving on to, we are going to have a near real-time access, hopefully, to the EMS data as well. And then what Jesse was mentioning with EPIC system is going to get even better. Yep.
I was actually going to ask almost the same question, so I'll ask something else. But first of all, I actually found your website last year and was always downloading all of your PDF files of your population or your health surveillance. So I'm really excited that you guys moved into Tableau, as those were extremely long and 400 pages of information. So that was really exciting. But have you guys at all thought about putting your surveillance on top of population health surveillance to kind of understand, how your Noxalone project management and those services are affecting the types of people, and who are these people that are using it, and in that kind of regard?
Right, yeah, great question. So part of my department is health status assessment. So what we are working on, and we are doing some strategic planning on this, is comprehensive community profiles. So what our vision is that we have a version of publicly available, and I can send you the link to that, publicly available community profiles. So we divide Alberta into 132 communities or local geographic areas, we call them. So we have, in the phase 1, we are providing demographics, cancer screening, cancer-related immunization, and all that. But the vision is that we are moving towards comprehensive community profiles, where we're going to start adding other pieces of information as we move on, and as Tableau gets better in terms of holding bigger amount of data, so that if you are living in a community, you go to your community and you can look at almost everything about your community, including the opioid information, immunization information, communicable, non-communicable diseases, and all that. So that's our vision. And we are sort of like running with Tableau. As Tableau gets better, we bring up better products. Like, I was so excited to see that Tableau is now going to be offering the heat maps, because for some publicly available dashboards, we cannot provide like dot maps. So because of the data security. So heat maps, we figured out a turnaround workaround using ArcGIS, and it's very cumbersome for us. But in the new version, we're going to start producing heat maps. So that's very exciting. So that is in our plans. Comprehensive community profiles is the vision, and that is going to be a very big project that we're going to be working on. And communities are going to be able to see a lot of information, so that then as you were saying, you can compare a lot of stuff. Yeah.
The other thing to note is ACO's population health management is not mandated in Canada. So this is all something they're doing proactively, unlike the US. Did you have a question there? We'll take that.
Hey, Jake Smith. I work at a hospital in Baltimore, Maryland. Thank you for this. This is awesome, and congratulations on your work. 2 curiosity questions. First, because so much of the opioid epidemic is driven by legal mechanisms for opioids to get into the community, namely bad prescribing practices, do you have now or any plans to develop any analytics to affect prescribing practices? And the second question, since you brought it up, with the legalization of marijuana in Canada, do you expect that to curb the opioid epidemic at all?
Great questions. So we also have access to our pharmacy data. And we are going to be expanding the dashboard, including the prescription. There's some other groups who are already working on that, and we are going to partner with them. I totally agree with you, because if you look at this this situation, it's a North American situation, and it is mainly driven by the opioid prescription practices. And if we compare ourselves with the Europe, this is not a big crisis there, because their opioid prescription practices has been very well controlled. The second question is something, I mean, there's no scientific evidence on that, but you might have seen that CNN documentary by Dr. Sanjay Gupta, where he has done that documentary that there is some anecdotal evidence where people using cannabis were able to actually come out of opioid addiction. Now, we don't have scientific evidence. I mean, there's more research that needs to be done on that, but that documentary was very compelling. And there are going to be possibilities, I think, in future. So once we see some evidence, we might be able to say something about that. Now, in Canada, we are a lab right now. I think countrywide legalization is not very common, and we are going to be learning a lot from our experiment in coming years. Thanks.
Yes, we are working on some service delivery metrics in addition to some surveillance metrics. And I wondered whether you were doing any of those. For instance, how long it takes to start an induction. So we're not wanting that to be longer than 24 hours. Or whether home inductions have different outcomes than office-based inductions.
Yeah. Would you be okay if I get in touch with you and talk about that? I'd be very interested in that. Thank you so much.
Next question, you have a question there?
Hi, I have a question for Jesse. I'm really impressed about how much your team accomplished since April last year. What is the secret sauce, moving so agile? What is the size of your team, and how do you move so quickly? And how long did it take to get sponsor support and budget secured leading up to that point?
So I have Shane in my team is one of our primary database guys. He also does Vises. Then we have a second guy named Ryan who does primarily Vises, and he also does database support. And so we've got innately a backup. I also do Vises, and so I've been working on that as well. Then we have Wilbert, who's helping us on the back end SSIS packages. And then Justine, who is our summer student. Wilbert's also our summer student, who's been helping us out with a lot of the data side and also with the Vises. And so I don't know about secret sauce, but we meet every morning and we prioritize our work. And then we meet, talk about what we're working on, what we worked on yesterday, and what are our barriers, which is literally Scrum. And then on a monthly basis, we go through all of our demand, we prioritize and we commit to what we're working on in the coming month. Everything else goes into our backlog. And then on the first of the following month, we go through and talk about what we're going to do for the next month. And so, at least in our organization, we do things that are very big, for the most part. And planning out, 3 months, 5 months, 2 years in advance, the accuracy gets diminished every day. For the most part, teams only know a month away. The work that actually needs to take place in the coming month, they can estimate that accurately for the most part. 6 months, a year, 2 years, by the time you hit into the 5-year long programs, it's very difficult to estimate because there's so many unknowns in such a large organization. So I think prioritizing your work, taking on small packages, focusing on one dashboard at a time. Secondly, the other key success factor has been SSIS. Now, I like the technology, but ultimately you could use almost any technology. The ETL process of ingesting data and making sure that is scheduled, and before you move on to the next data source, don't create Tableau dashboards from Excel. That's just my personal mantra. The data is snapshot and is out of date the second that you publish that dashboard. Having the ability to actually schedule the ingestion of that data into either a data warehouse or accessing that data directly from a database, those are the two best methods. If you don't know how, certainly reach out to us. We have SSIS packages for MySQL and Pervasive and SharePoint. in Excel, frankly. We do ingest some data from Excel, but not much. And so, but my point is, schedule that stuff to get sucked into a database and leverage a database technology. The work that we're doing needs to be current, and that's, in my opinion, the only way to do it. And secondly, then you can leave it. You don't need to bother. I mean, if it's scheduled and that you don't get an alert or an email saying that it failed, just let it keep rolling, and then you don't have to worry about it. So. No, they do not. And we have many. So yeah, we've got a large team of analytical groups across the business. So yeah.
Unfortunately, that's all the time we have.
Yeah.
I'd like to thank Jesse and Hussein for an awesome presentation.
Yeah, thank you so much for attending.